Hi, I'm John Knutson with River Channel. Today we're at the Hudson Emergency Medical Services Facility, and I'm with Director John Muller of the Lakeview EMS, and he's going to introduce himself and his staff.
Yeah, hi, thanks for having me. Today I'm going to have two of our paramedics that are working today, Brendan and Tim, show you some of the equipment that we use, some of the more vital equipment that we use. We're not going to go through all of it, but turn it over to you guys.
We can monitor your pulse, your heart rate. We can do a 12-lead EKG to see if you're having a heart attack. And if you are having a heart attack, we can bring you to the best facility down to Regions Cath Lab for further treatment. What else do we have here? We have a Hamilton vent, so we can take intubated patients that are on multiple drip medications. We can put them on our ventilator, keep them breathing with this machine. We also have pumps when they're on multiple medications for critical care transfers. We can put medications in here and run them at the appropriate rate. And then we have the Lucas device. This is for if somebody is in cardiac arrest. We have a pretty simple machine to operate. So this would go underneath the patient, and then this would go on the left and right side just under their armpits. We lock it into place. And then we hit button number 2. We bring this down to their chest. And then we can hit play to do compressions, so we can free ourselves to do other tasks for a cardiac arrest. And this thing can run for about 45 minutes.
So the Lucas device allows us to do continuous compressions, high-quality compressions for patients whose hearts have stopped, including while we're moving. Obviously, it's something that's very challenging to do manually if we're lifting and moving a patient or if we're in a moving ambulance. This device allows us to do continuous high-quality compressions, which both allows us to do additional important tasks to help that patient breathe and give them medications to get their heart started, but it also allows us to transport them for higher levels of care, for example, to Regions or someplace like that, to be able to be placed onto heart-lung bypass, which is called ECMO. So this is our first in bag that we bring with us to every call. Inside, we've basically got all the equipment, tools, and medications that we would need to care for somebody in the first 15 to 20 minutes of our encounter, whether it be for a traumatic injury or an illness or something more severe. We've got our equipment to be able to manage a patient's airway in this bag. We have our medications in this bag. We have equipment to establish IVs or intraosseous, which is basically a needle into your bone in case we need to give medications or fluids urgently. We carry with us a bag valve mask so we can breathe for somebody manually. And then in some of the other pouches, we have some more advanced equipment for patients who have collapsed lungs or who have open or sucking chest wounds. We can help repair those temporarily. So for the majority of the times that we're transporting patients, they stay on this stretcher mounted to the floor of the ambulance. It's mounted in such a way that it's extremely safe and secure. Even if the vehicle were to be involved in a significant accident, it's basically bolted to the frame of the vehicle. So this stretcher does not move when we're en route, and we're able to safely secure the patient there. Then we're able to work on the patient whether we're seated next to them or behind them at the head of the stretcher, depending on what we need to do. In some instances, most of the time we're seated on this bench seat here or in the seat over there so that we're able to talk face-to-face to a conscious patient, as well as keep an eye on their rhythm on our heart monitor and monitor their vital signs. Sometimes we'll sit at the head of the stretcher if we need to manage their airway, so if we're breathing for them or helping them breathe, we'll be seated in that position. But in general, any one of these seats allows us access to be able to do all the things that we need to do for our patients.
This is our module for our emergency lights. So we can hit this master button, it'll turn the lights on, and then it'll have an opticon which changes the stoplights to, for us approaching, it'll turn green, and then the other 3 intersections will turn red for when we're going lights and sirens to a call. And then we have radios that we can communicate to Washington County or St. Croix County if we need more information from dispatch of those counties. Also, we talk to our dispatch through our own radios, and then we also have a CAD system where the call will pull up and we can click on that call, see what the call is, we get the address, and then we can click map it and it'll show us how to get there based on a couple different features of automatic zoom or directions to the call if needed. And we can see what other units are doing as well.
And now we're at the Emergency Medical Services facility here, and John Muller is going to talk a little bit about when Lakeview EMS started providing services here in the Hudson area.
Yeah, Lakeview started providing EMS services to the city of Hudson and the surrounding communities around Hudson back in September of 2019.
Well, and I know the demand has been awfully high. Can you explain a little bit about the expansion of facilities and services that has gone on?
Yeah, we knew when we were negotiating with the city of Hudson whether we were going to provide the service or not, that someday we're going to need a facility over here. We're not going to be able to sustain operations in the previous buildings they had. So we started planning on building on this site. This property was owned by the hospital already. It's an ideal location for us. We have quick access everywhere. So we started construction on this building in October of 2019, and we moved in February of 2020, so right after COVID hit.
Yeah, it's a great facility. Maybe you can explain a little bit about your ambulance bay here, and then we'll go on a tour inside.
Yeah, absolutely. So in here we keep 3 ambulances here. There's one that's out on a call right now, so that's the reason for the open spot. But 2 of them are in operation 24/7, 365 here at this base. So our crews, our paramedics come here, they start their shift here, they check in with dispatch. This is their home base. So they stay here. The 3rd ambulance is a backup. So we constantly do maintenance on our vehicles. So if one's getting worked on, the companies come here and work on them. They can use the other truck while it's being worked on. Or if a crew comes in the morning and both ambulances are out, which is kind of frequent, they have another ambulance that we can put in service.
Terrific. Let's take a tour inside.
Yeah. All right. So we're inside the EMS quarters now. Both of these sides are identical. So we have 2 sides to this part of the building. Here we have a supply room the radios are in there, the batteries for the stretchers, batteries for the cardiac monitor. They're just constantly in chargers all the time. Our linen supplies are there. And then we have resting rooms for the paramedics that are on duty. So here at this base, we have 4 people on duty every day. So we have 4 separate rooms. This side of the building, we have two resting rooms and a restroom on this side. Restroom has all the amenities that any restroom would, including a shower, because they work 24-hour shifts.
Yep. John, what type of a geographical area does Lakeview EMS cover?
In our Wisconsin service area, it's roughly 125 square miles. In our whole service area, including on the Minnesota side, we're a little over 300 square miles.
And then how many patients do you see on an annual basis?
Yeah, our total volume for the whole service, Minnesota and Wisconsin, is last year we did 12,300.
Wow. I know you talked about the ambulances out in the ambulance bay. Talk a little bit about your team and your staff. How many total paramedics and EMS folks do you have?
Yeah, so currently we have 54 paramedics. 54 includes myself and my operations supervisor. So actual paramedics that we schedule on the ambulance, that's 52. So
Terrific. How about the rest of your facility?
yeah. So here we have a kitchen. Again, when you're doing 24-hour shifts and you're doing the kind of work that we do, you never know when you're going to have an opportunity to eat. So we have all the amenities that you would have at home because they're basically living here, and they need to have that while they're here too. But they see a lot of stressful things. They work hard, so it's good for them to have a place to sit down and relax and cook their own food if they want.
Okay.
The holidays, they work holidays, they always plan meals with each other and bring their food here and cook it. So.
Yeah, with how intense the work can get, I'm sure having a comfortable facility like this helps them in the downtime.
Right, yeah.
So, John, what I would say the most critical factor, I think, to most viewers is going to be the response time for EMS. At least it would be for me.
Yeah.
What can you tell us about Lakeview EMS response time?
Yeah, so it's one of the things that we monitor all the time, continuously. Really on a daily basis, I always look at response times, and we have a goal. Our goal is always to respond on average within 8 minutes. We have some parameters set in place under contract agreement, but we average over here in our Wisconsin service area, our average response time is 5 minutes and 51 seconds.
Terrific. As a longtime resident here in Hudson, I'm awfully glad, and the city of Hudson, I know, is awfully glad to have you and your team here doing a great job. Now let's go look at Hudson Hospital's Emergency Center for more information.
Yeah.
So Cortney, Hudson Hospital is a level 4 trauma center. Can you explain that designation and what it might take to maintain that?
Level 4 just means that we have the providers, meaning our doctors and our physician's assistants when we have them. Our nurses and our staff are all trained to take care of anybody coming in with a trauma need. And we also have the resources to either treat them here, admit them if needed, and then provide ongoing trauma-based care, or we can stabilize and transfer them to our level 1 trauma center, which is Regions in St. Paul.
We're in one of your emergency rooms right now. Could you give us a brief description of some of the equipment and the materials available in this room for patients?
Yes, of course. So this is one of our standard rooms. So most patients, if they come here, this is what the room is going to look like. They're all pretty identical. We have a monitor right here that we would hook most patients up to. We like to get a good full set of vital signs, so don't be alarmed. It gets loud sometimes, it beeps, but that doesn't always mean anything bad. And then we have the capability of disconnecting this and taking you elsewhere throughout the hospital and not losing any of your vital signs or any of the data that we collected with this. These are our beds. If you've ever sat in them, they're not always the most comfortable, but there's much less comfortable, I promise. And they're pretty fancy. They can drive, so it's easier on our staff. We just push these buttons and they kind of drive around. You don't need a license to drive them, but maybe you should because it can be pretty tough to steer. And then all the rooms have an IV pump, as you can see right there. That's how we give medications in a controlled way. And then we have a computer and a printer, so we don't always have to leave the room if we need to label your labs or anything. All of our IV equipment is housed right there in that cart. And then we have a sink, gloves, pretty much everything that we need is in the room, so it's pretty nice. In the cupboards we have things to change the bedding and clean the room. And that's the beeping I was talking about.
Cortney, we're in a different room right now. Maybe can you explain to our viewers the different types of facilities you have here?
Yeah, absolutely. So we have 12 total rooms since our remodel in 2020. We went from 6 to 12, so we doubled our size. This room is specifically called a trauma room. We don't always have to put traumas in this room. We can treat any patient in any room that we have here. But this one has a little different capabilities. As you can see, there's a lot more bells and whistles in this room. We have an IV pole with extra IVs in case we need to give multiple medications at one time. This cart right here has a video. It's called a video laryngoscope. So when the provider, if needed, has to intubate a patient, meaning they need an airway, they use this camera so they can see down, which is pretty fancy and really exciting to have here to provide for our patients. This big boom holds all of our monitoring equipment, so we can move it out of the way. If we have a trauma or a cardiac arrest in this room, it can get pretty busy, as I'm sure you can imagine. So it's nice to be able to move that and get it out of the way. And then we have a couple special carts that holds special equipment that we might need in the event of a trauma or some type of procedure that we might do. And as you can see in this big, large poster right here, we have a lot of criteria that we use when determining if we're going to call a trauma team activation. We look at all kinds of things, and when we decide that this is a trauma, we have a fancy button that we push on the wall. It overhead pages trauma team, room 9, multiple times. And what that does is it activates a team, most of which are based within our ER, but it lets our lab staff, our imaging staff know that, hey, we might need your services really quickly. Lab realizes that we might need more blood products. Imaging knows that they need to clear some of the scanners to make sure we can get quick images if it's something that, that they need.
Your facility is staffed by emergency medicine physicians from Regions Hospital, and they're a level 1 trauma care center. Can you explain what that means and how it is good, or how it works with your team and, more importantly, the patient?
Yeah, absolutely. So we transfer a lot of patients to our level 1 trauma center at Regions Hospital. And I think it's really important to note that they're not only an adult level 1 trauma center, they're also a pediatric level 1 trauma center. And what that means for our community is that the doctors that we have here are equipped and knowledgeable, and they know how to take care of you or your loved one, whether you're 1-year-old or 80 years old. And the difference between a level 1 trauma center and us as a level 4 trauma center is that they have everything that they need within their hospital. So they have neurology 24 hours a day. They have cardiology 24 hours a day. So any type of surgical need that you might need from the injury that you sustained in the trauma, they are able to offer all the time. So as a smaller hospital, we can't offer that immediately, but we have our wonderful partners with Lakeview EMS who can get you there quickly and still get you the care that you need.
Cortney, I know it's important for the residents to understand that you and your team are trained specifically in mental and behavioral issues for patients. Could you explain a little bit about the room we're in and what advantages you have for patients?
Yeah, absolutely. So we are in one of our 2 safe rooms that we like to use for our mental health patients. They're different from the rest of our rooms in that we can lock everything either down or remove it from the room to prevent any harm to the patient, intentional or unintentional. I can show you this pulls down and we have a key that locks this. That side does the same thing. And everything in this room is portable. I don't know if you remembered in the other rooms, the computer was connected to the wall. In this room, it comes out. Everything comes out. There's nothing that is permanent within the room. And it just provides a safer environment for those mental health patients.
Cortney, could you tell us a little bit how you and your staff manage the behavioral health care for patients?
Yeah, absolutely. So we are lucky enough to have a partnership with Hudson Behavioral Health, who is based right here out of our hospital. They provide tele-services or virtual assessments to 7 different hospitals, but we have them right here in our hospital. And what that means is that a licensed provider is going to be coming in and providing an assessment face-to-face right here in one of these rooms, and they help provide either a safety plan if necessary so that the patient can go home with their family, or they'll help facilitate a safe transfer to an outside facility to get the best care that they can have.
Well, Cortney, your facility is wonderful and a huge advantage for the Hudson area to have in our community where we work and play. And I want to thank you on behalf of the River Channel. I'm John Knutson, wishing everybody a great day.
Thank you.